Hi, this is Dr. Eric Dein with Room Now, coming at you after a wonderful day 3 of EULAR. Today I'm going to talk about Sjogren syndrome, and particularly the risk of lymphoma in Sjogren's patients. This is coming on the heels of a great oral presentation, number 0291, looking at the ability to use focus scores to see if we can predict the risk of lymphoma development in Sjogren's patients. When I think of Sjogren syndrome, I know that lymphoma is a huge problem, particularly malt lymphoma. There's a 19 times increased risk in lymphoma development in patients with Sjogren's. I usually think of the main predictors being the ones I learned of being low complement, C4, palpable purpura, parotid gland enlargement, and monoclonal gammopathy. Focus score is usually not something that I think of as a prognostication for lymphoma. Usually I think of it more from a diagnostic perspective. It's part of the 2016 ACR EULAR criteria for Sjogren's. But here, they did a great study looking at the prognostic value of it for lymphoma. What is the focus score? Again, it's looking at the lymphocytic infiltrate localized around the ductal epithelium of salivary and lacrimal glands. The score is actually the number of sites with mononuclear cell infiltrates, more than 50 inflammatory cells per 4 millimeter square. And so they give you a score from 0 to 12, with at least 1 being considered a positive biopsy. We do know that the focus score correlates with more autoantibodies and more extraglandular manifestations. It's been suggested in the past that it does correlate with lymphoma development, but there's hasn't been a study quite as robust as this to demonstrate it and help guide our use of it. So this comes from a cohort of patients from Italy and Greece. They looked at 560 patients with Sjogren syndrome that did not have lymphoma and compared them to 58 patients with Sjogren syndrome who did have lymphoma. And they found, as per their hypothesis, that lymphoma prevalence increases with the focus score, and that the higher the focus score, the higher the risk of developing lymphoma. They then did some statistical analysis to try to find an area of separation, and they determined that a focus score greater than or equal to 4 was the best way to separate those at the highest risk of lymphoma to those with a lower risk of lymphoma. This group that was focus score of 4 or greater, they had increased risk of salivary gland swelling, lymphadenopathy, increased autoantibodies, so ANA, rheumatoid factor LA, cryoglobulinemia. They had higher risk of monoclonal gammopathy, as well as the higher risk of lymphoma. Interestingly, they also noticed that this group also had a decreased incidence of autoimmune thyroiditis. So the authors took this a step forward, and they then used the data that they found, and they, as part of their conclusions, they recommended possibly changing management with it, and they recommended doing a second biopsy in all patients with a focus score of 4 or greater at 4 years' time to follow and surveil these patients. That was something that they didn't have any evidence for. That was taking the next step based upon their data, and I think that would be something that would be helpful to get some more research in the future. But I do think having that cutoff of 4 or greater is something that I think is clinically useful, that we know that the higher the focus score does certainly seem to show that they're at a higher risk of developing lymphoma, and using that along with those other predictors that we classically think of in assessing the risk of development when we meet patients with Sjogren syndrome. As part of the discussion in the Q&A, they talked about some of the limitations of the focus score. Certainly some patients you do not need to do a lip biopsy in order to make the diagnosis, and it is somewhat of an invasive procedure. It is certainly subject to the pathologist that's reading the lip biopsy to determine the focus score. So making sure that that's done well and using that to the best of the effect, if it was done, in order to help you classify those patients. So I think some really great stuff coming out of the oral presentations today, as well as the posters and all throughout EULAR 2021. I'll be covering it more throughout the conference with Room Now, and you can check out all of our work at roomnow.com. Thank you very much. This is Dr. Eric Dein. Have a great rest of the conference.